Hello everyone, Dr. Luca here, and I'm standing in our traction room or decompression room. When you apply traction to the spine, it decompresses the discs, and we want to open up those joints. So we do some long axis traction. When patients come in and they get older and the joints degenerate, oftentimes discs bulge and the nucleus will press out against the nerve. And so after we do some drop table adjustments and some other types of adjustments, we will perform some long axis decompression, or you just call it traction, to open up those joints. Now, how does this work? You can lay face down or face up, whatever is your preference. It really doesn't matter. The table doesn't care. Gravity doesn't care. So say you lay on your back. You put your feet up here. We put a seat belt around your hips and then one around your upper back. And the table has a spot where it opens up. And if we unlock it here, it'll open up. And then this just slides open as we apply some light decompression. Now, do we set you up in this table for an hour and then turn it off? No. The table's programmed. If you wanted to stretch my some of my chest muscles, we'd squeeze my arms together and give it a break. We'd stretch it a little bit more, and somebody may help me, give it a break. We wouldn't just pull my arms as hard back as I could stand it, and then 30 minutes later I'm done. That's not the way the technique works. This is no different with the discs in your low back. So the joints, about a 30-second stretch is applied, and then it ramps up, and then it relaxes. And so there's different ways we can program these heads to do the decompression or the traction. It opens up the joints, and it gets that joint, and that gets that disc moving. Some patients have a lot of arthritis, so we just ramp up, we get to the top, and it comes right back down. There's no hold. And so we call that our acute setting. And so we want to open up those joints and get some of that disc and that pressure off the nerve. That helps with the sciatica pain down the leg. Or if you look on the far end, I think you might be able to see it. There's one set up for the cervical spine. So we want to combine this with the right kind of chiropractic adjustments, and patients do fantastic. This is one of my favorite therapies. Way back in the day when we were on Poplar, I remember buying one of these tables, and we were so busy. We had people waiting in line, and we had to schedule them every so often. So I actually bought 2 more after I bought the first one to get 3. There's 5 in this office on 26th Street. There's 3 in Corey, 3 in Meadville, and there's 3 in Harbor Creek as well. So this is a great therapy. It works particularly well for patients that have disc bulges. I'm going to shoot another video on that, so stay tuned. I'm going to bring out the model and show you exactly what kind of disc bulges are, what they are, and so you can see it on a blown up model of the lumbar spine. Thanks so much.